What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy, testing negative for the viruses, and having a great day so far. It is time now for the Wednesday edition of the Virus Update for Wednesday, September 3rd, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed of what's going on with these viruses. That's what I do here on my channel each and every day. I give you the latest news, data, and anything I can find to help keep you safe and informed of these viruses. Want to stay informed? Just subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. Already, we do have several news stories today and updates that we will get to in the news portion of this video. Then we're going to take a look at some daily data and, yes, some new data from New York State, and we'll probably also take a look at a few wastewater sites in the United States as well. Alrighty, starting off with this. This is something we look at almost every week. The PMC dashboard update for the U.S. from Mike Horger, and this is thread. This is post 1 of 8 of the thread. We're not going to look at the whole thread, but we're going to look at a good portion of it. And this is the 11th wave of COVID that we are in, and he says it is still rising. And 23 states and territories are listed high or very high when it comes to COVID. The very high states are as follows. Very high would be Alabama, D.C., yes, Washington, D.C., Guam, Hawaii, Louisiana, Nebraska, Nevada, South Carolina, Texas, and Utah. 1 in 56 estimated actively infectious. 876,000 new daily infections is the estimate at this time. California, as mentioned yesterday, is still very high on the map there from the CDC, which he added some text to it, and you can see here, 1 in 30 actively infectious there. PMC dashboard this is tweet 3 of 8. Here are the prevalence estimates for the first half of the states and territories. Notice how high the levels are in some of the moderate states. Yeah, you can see here, wow, actively infectious. It's pretty high. 1 in, like, Illinois. 1 in 195. That's actually very low. Hawaii is 1 in 21. So you can see, very low would be 1 in 195. But then you go to Hawaii, which is very high, the complete opposite. And you see 1 in 21, and you also see California 1 in 30, Delaware's 1 in 35. We also see Minnesota, which is moderate. Hey, 1 in 46 people are infectious. Low in Pennsylvania still, 1 in 96. Nevada is 1 in 18. Yikes, that's wow, that is very high. But if you think that's very high, we can do worse. South Carolina, 1 in 17. Utah, 1 in 15 people, very high, are actively infectious. So in other words, in Utah, let's take a look at this over here. In a room of 10 people, 51% chance of catching COVID. 25, 83% chance. 50, 97% chance. And 100, it's almost a 99% chance. Think of school classrooms where, you can have up to 30 students in a class. That's usually the maximum for most. Maybe some schools that have problems, capacity issues, maybe it's higher, but you get the point. He says here we're in the 11th COVID wave. Many are getting infected while waiting on delayed vaccine approvals. Millions more are being denied vaccine access entirely. Yes, there's a lot of issues with vaccines here in the United States. We may end the news portion of today's update with a little news on vaccine. We'll see. I also may skip over that. Few public health groups mentioned the importance of N95s and air purifiers. N95, don't know what one is? This would be an N95. And take a look at this. Looks like cases may go up a little bit longer here and then eventually peak relatively soon. We should see a peak. All right, he also says, let's see what else. We just had the largest relative increase in summer transmission in 4 years, but transmission has leveled off, the red line shown on this map. This is atypical based on the most similar prior waves, blue and yellow. But I got to tell you something here, and he says it here. and maybe a spelling issue. I think that should say, we may see a retroactive correction upwards. You know why? We just had a holiday weekend. There's a little bit of a lag in the data when that happens. And he did improve his forecasting model based on the newest data. You can see here, going to be a little bit more of a bump upward and then potentially a peak, but there is a worst case scenario where it just keeps going up, or there is a best case scenario where things start going down. And the middle of the road is what is shown here on the map. Alrighty, moving on. We have several more things to take a look at. New Zealand, COVID weekly update, August 25th to the 31st. New cases, 469. That's down by 11.6%. Reinfections, 271, or 57.7%. Deaths, 4. Total deaths, 4,780. In the hospital, 50. That's down by 19.3%. 57.7% of the cases this week were reinfections. COVID deaths attributed COVID deaths, 4. Not COVID, 0. Not available, 8. 1 was in their 30s, 1 in their 60s, 2 in 70s, 4 in their 80s, and 4 were over 90. So they had 8 total deaths. 4 of them they're pretty certain that they were COVID. The others, not so sure. Also, what's this? New Zealand will no longer give timely COVID death updates from July 17th, 2025. Deaths are only reported via mortality collection, a slower process that lags weeks or months. Official counts will look lower, but the deaths are still happening. Why do they gotta go and change things? All right, we do have more from Dennis, the COVID info guy, and I believe this is also New Zealand, St. John, which I had to do some research. What does that actually mean? Well, St. John, I guess, is an EMS operations there, and not for all of New Zealand, but it's a pretty large operation. And, well, get this is not good. St. John reported its busiest winter ever. Remember, it's wintertime in New Zealand right now, with record call-outs in July and August. Over 50,000 ambulance incidents were logged in August alone, including 6,000 breathing difficulty cases, up 33% on the yearly average. Yikes, that's a big increase. Now, I don't know what the total population is of their coverage areas, but that's a lot of EMS incidents, don't you think? Yikes, that's really bad. And here's actually the full article on it. 50,000 EMS calls. We have seen a significant rise in respiratory-related emergencies in the past year. Ambulance crews responded to almost 6,000 cases of breathing difficulties, up 33% on the 12-month average. My goodness, folks, that is just terrible. Brazil health officials urge people to stay updated on COVID-19 vaccination. Why? Because cases of the virus are rising in 4 Brazilian states. That's also Dennis, the COVID info guy. Wisconsin, measles outbreak grows. And guess what? Ohio has now reported more measles cases. Yeah, the outbreak in Wisconsin continues to grow. They have a total of 23 cases. And an Ohio family in Zanesville, Ohio. Yes, Zanesville Department of Health is announced that there is a cluster of confirmed cases in a family, and it looks like all 3 are unvaccinated at this time. Wow. The confirmed cases in children, and all 3 are unvaccinated. That seems to be a theme that we're seeing here. More on that in a little bit. NET Health confirms adult case of measles in East Texas. Look at that. Now, this case, it looks like the person was self-isolated, and looks like they're already through the virus. So they made out okay, and looks like any exposure risk it's passed. Delaware County, Pennsylvania is reporting that they are seeing a West Nile virus case, first case. So you know what that means. They're going to go out and spray for the virus. We've been seeing West Nile virus cases pop up around the country. I haven't done a lot of research on that particular one. I just happened to see this on my X feed yesterday because I follow stuff for Delaware. I follow stuff for the Philadelphia area. I live in the Philadelphia area. All right, New Hampshire is seeing a concerning increase in the number of whooping cough cases. Yes, that is a number that is rising according to data from the New Hampshire Department of Health and Human Services. As of June 30th, the state has seen 63 whooping cough cases this year. Obviously, being June and that being back in June and now we're in September, that number is likely even higher than that. So that's not a good thing. And, we have tracking threads over on my website, datareport.info. Several students have contracted hand, foot, and mouth disease at Sherwood Elementary School in Memphis, Tennessee. Yet again, we're seeing hand, foot, and mouth disease pop up quite a bit. I might have to add that to my daily searches where I just literally type that into the search. That's one thing I don't have on my list over here. But yeah, I think we're going to continue to see more school outbreaks. A whole bunch more schools, at least in my area, just went back yesterday. So we're still in the middle of the back to school season. And it continues, and there'll probably be more illnesses. Obviously, the biggest time for school outbreaks, as we all know, and we learned last winter, is the winter time. All right. Did I want to show this? Do I not want to? Well, I'll show it. The state of Florida will move to end all vaccine mandates. And what that means is, no, we're not just talking about the COVID vaccine. We're talking about COVID, measles, polio, whooping cough, any vaccination that it was usually required for a kid in school. We're talking COVID these days. That's not a mandated vaccine, but you get the point. Yeah, I kind of had problems with some of these. Okay, for COVID, I will always say, you do you. You do whatever's in your best interest. However, when it comes to some vaccines, like the measles vaccine, which I'm pretty sure a lot of us got when we were kids, right? I'm 35. I'm pretty sure I had the measles vaccine as a kid. We're learning that the majority of the cases of measles this year, and here's the CDC. Let me refresh this just to make sure I have this updated. 92% of the cases of measles in the United States this year are unvaccinated or unknown. 4% had one dose, 4% had two doses. It sounds like the majority of the vaccinated cases, which there's not a lot of them, are people who may have been vaccinated decades ago. So, the vaccine is working. But here we are. State of Florida wants to limit. It is what it is. Florida has had a high number of COVID deaths. They've had a high number of other virus issues. Let's look at Orlando. We've been watching Disney World area go off and do its own thing. But it's a sign of the times. Many people, I don't know. I'm not going to say anymore. I'm going to move on because it's such a controversial subject. But there are certain things that it's just like, why? And you know what the next step would be afterwards? Just saying, no, we're not allowing the vaccine, period, in our state. I don't know. Is that going to be what comes down the line? I honestly just do not know. We'll get an update from the UK tomorrow when it comes to COVID. Let's see what's going on in Canada. COVID-19 is moderate. Flu A is low. Flu B is low. RSV is also listed at low at this time. Taking a look at air qualities, well, I don't have much to say about this other than the fact that we still have problems in some places. Yeah, the West Coast. Take a look at that. Really bad in parts of California. Really bad in Washington, Idaho, Montana, and even portions of the northern plains now, and western Canada, Alberta, British Columbia. You really want to be careful if you're going outside. You may want to consider wearing a mask outside because air quality values there are just so bad. Let's take a look at birds in migration. I need to refresh this. While this is refreshing, let's pause and take a hydration break, shall we? Isn't that rather refreshing? All right, let's see how many birds migrated over the last 24 hours. And at the peak, take a look at this. It does get to yet again. Wow. Matter of fact, even higher. 500 million birds at the peak last night migrated to the south or even southeast for winter. Yeah, it is that time of year. Like it or not, summer is slowly coming to an end. Or in some cases, some people are saying, it went by so quick. Yeah. It does feel like summer went by fast. And in the case of this COVID wave, we may want summer to end so we can get this COVID situation that we have going on in the United States to start to drop so we can get a lull before whatever comes in the wintertime. All right, Pinellas County, Florida. Sick person calls. Yeah, a couple of them. But we are seeing less calls today. That is a good thing. Philadelphia, on Monday had 754 EMS incidents. Of course, if you saw yesterday's video, you knew that. Here's Tuesday's number. 795 EMS incidents reported on Tuesday. Let's take a look at what's going on in Montgomery County, Pennsylvania, We do see respiratory emergency listed 3 times there. That's not a good thing. And a couple other things, but not terribly busy. Let's take a look at Chester County, which, who knows, could be the exact opposite of Montgomery County. Okay, all right, maybe we can't see what's going on with Chester County. It looks like they're having some sort of an issue at this time. Let's go back, try it again. No, it says error. This happens once in a while. Moving on now to Bucks County, Pennsylvania. 3 is not a correct number. Let's see what the real number is. Yikes, I'm seeing 11 calls, and I'm seeing respiratory distress show up more than one time. I'm also seeing cardiac issues, COVID, excuse me, not COVID, stroke at this time. Hey, those respiratory emergency calls, that could be related to COVID. I wish they would tell us when there is a call for COVID. This is not good. Take a look how many hospitals in Pennsylvania. Let's refresh this, make sure it's up to date. Yeah, I thought that seemed kind of off. There were a whole bunch of hospitals in the Lehigh Valley that were yellow. After yesterday's video, more hospitals had appeared, but nonetheless, there are still some hospitals with problems. And we can see here that there's overcrowding issues at Lincoln Hospital. That was not updated since yesterday, but the one up top, yeah, that's updated today. So why there's 2 messages there, I honestly don't know. 1 hospital in Lehigh Valley has a problem. 2 in central Pennsylvania. What's going on at Penn State Health Holy Spirit Medical Center? Here's one we don't usually see with a problem. Emergency department is overcrowding at this time. In New Jersey, what's going on there? Let's see. We do have Inspira Medical Center. Mullica Hill has a patient volume. Jefferson Stafford Hospital has some sort of a specialty issue. And we have a psychiatric issue at a university hospital at this time. All right, I got to show you New York State. Take a look at this. 532 new cases. The number of cases, it didn't go up a whole lot. We'll see what happens on Thursday when we get the update from New York City. But this, you got to see. Big increase, and I get it. There's the lag there. You can see the white blank area. That's the lag in data, but yeah, big increase in hospital admissions. So the biggest number last week was 172. It's 215 this week. You can clearly see here it's a big increase. Part of it's from the lag. Part of it's also because, hey, things are still rising. When we take a look at hospitalizations in New York State, they did go up today. 416 hospitalizations and 46 people in the ICU at this time. Alrighty, let's take a look at what's going on with wastewater, shall we? And we'll refresh this. We'll go to the nationwide level. And well, here's something that has not changed. The entire U.S. is still listed at high levels of COVID. Here's the chart. X out the wonky movement. And you can see here, it does continue to go higher. We also see EVD68 is very low, going up a little bit, but it is at extremely low levels right now. And we can see here everything else seems to be fine at the moment. Let's go up to the Midwest and see what's going on there. We see the Midwest region continues to rise for COVID at this time. Let's do one wastewater site there. How about Bloomington, Indiana? And we can see there, wow, rapidly rising COVID at that location. Hepatitis A, some detections of that. Now let's go over to the Northeast. And we see in the Northeast, you got it. You guessed it. It's still going up. X out that wonky movement, and, well, it still would be an increase at this time. Let's take a look at what's going on in Boston, Massachusetts. Shall we? We see here, yeah, COVID's rapidly going upward, according to that, and it may get corrected to slightly less of a rise, but nonetheless, COVID is still going up. Now let's go down to the south, and we can see in the south, COVID levels are still high. Wastewater, though, is starting to peak. It is showing signs of a drop there. Let's see what's going on. How about we go to Columbus, Georgia, shall we? We can see, still pretty high levels there. And everything else looks to be fine at this time. Let's go out to the West Coast and see what's going on there. Yes, COVID is still high. Hopefully starting to peak, but, there's a little bit of an upward trend once again. So we're going to have to continue to keep our eyes on that. And where do we want to go? Well, we can't go to any of these gray sites. How about we go down to Las Vegas and see what's going on there? Las Vegas is medium for COVID. Most recent update dropped a little bit. That could get corrected. And everything else seems to be fine at this time, some detections of hepatitis, and there was a measles detection back on August 1st. Alrighty, folks, that does it for the Wednesday edition of the Virus Update. If you enjoyed today's virus update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know. Leave your comments down below, and ways to support the channel are listed down below. I will see everyone again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday afternoon. Thanks for watching.